Dear fellow scholars, this is a new episode with a special guest. Today, we are going to see how AI has learned to read your medical history like a book to forecast your future health. Specifically, it is able to predict more than 1,000 diseases years in advance. This is super exciting. So, let's have a look! This work is done by scientists at DeepMind, the AI company founded by Demis Hassabis, the guy who also created the super intelligent chatbot. In their paper, they write that their goal is to move the needle from treatment to prevention. That is, instead of waiting for a disease to manifest itself and then treating it, we would like to predict it in advance and perhaps prevent it or at least delay its progression. This is an amazing idea. They call their new method Delphi 2MY. Delphi, because it is like the Oracle of Delphi in the ancient Greek city of Delphi, which, according to legend, was a position of a prophet who could supposedly see the future. The 2M in Delphi 2M stands for the 2 million people the model has been trained on. More on that in a moment. What can this AI do? Well, first, it reads your medical history. For this, it uses the UK Biobank, which contains data from 500,000 people in the UK. Then, it looks into the future by simulating the progression of diseases over time. And it compares these simulated results with actual outcomes from the UK Biobank. This way, it learns what a healthy life looks like and what the warning signs for diseases are. After training, the researchers tested their method on a completely separate dataset from 2 million people in Denmark. And it gets this. It was able to identify people at risk of more than 1,000 diseases and some conditions years before doctors could spot them. Wow. Some examples. It can flag people at risk of a heart attack up to 10 years before it happens, or stroke up to 5 years in advance, or dementia up to 7 years in advance. This is absolutely incredible. I think there are many ways this could help us. First, hospitals could use it to better plan their resources. They know in advance which departments will be busy and which specialists they will need. So good. Second, doctors could use it to counsel patients at risk of a particular disease. Imagine your doctor saying, based on your medical history and this new prediction, you are at risk of disease X. Let's do some blood tests and keep a close eye on you. That sounds like good medicine to me. Third, it could warn patients at risk so they can take action. Of course, for some diseases, there is no known cure. But for many, there is. Think of diabetes, for example. If one is at risk, one can change one's diet and lifestyle to perhaps prevent it from happening. And of course, in all these cases, we need to be careful and make sure that the AI is not perpetuating existing biases. After all, the data it has been trained on is mostly Eurocentric. So, more data from other parts of the world is needed to improve its accuracy and reliability for everyone. All in all, this is super exciting research that is still in the works and not quite ready for the clinic yet. But if it can be scaled up, I think this will become a standard part of our health checkups. Just like the weather forecast. By the way, the weather forecast also came out of a paper that was published in Nature just a few weeks ago. You see, science is moving so fast these days. It can be hard to keep track of it. Thanks for watching and for your generous support, and I see you next time.